My name is Jessa, and I will be presenting my research on the overmedication of foster youth. The overprescription of psychotropic medications is a growing concern, particularly when these medications are used as a quick fix rather than addressing the underlying emotional and behavioral struggles. This study explores the issue and proposes trauma-informed care as a solution. The issue is important because it still affects and has affected and has dire consequences on the children in America who are overprescribed medication. One such case was in 2009 with a boy named Gabriel Myers, 7 years old, who died by suicide. At the time of his death, he had been prescribed multiple psychotropic medications, which raised concerns about how these drugs were being administered to children in the foster care system. Because it was inadequate monitoring of medication effects and insufficient mental health support, Gabriel's story highlights the risks of using psychotropic drugs as a default solution rather than addressing underlying behaviors and mental health disorders. While that case was in 2009, it still continues to this day, with numerous examples throughout the years where children have died or suffered major consequences due to the overprescription of medication. The background of the issue are that foster children are frequently prescribed antidepressants and antipsychotics to manage emotional and behavioral issues stemming from past trauma. However, these medications are often given without addressing the underlying trauma that contributes to their difficulties. Research shows that foster youth are disproportionately prescribed psychotropic medications compared to their non-foster counterparts, which raises ethical concerns regarding long-term mental health consequences. As you can see from this table from Boyd, you can see the amount of medications that are prescribed to foster youth at very young ages. Some of these medications we can rule out for some just physical disabilities or health issues, but when you look at ADHD and some of the other mental health disorders, you can see that a lot of these kids, like very young ages, are prescribed multiple medications for their conditions. The problem is that psychotropic medications are frequently prescribed to manage behavior rather than provide actual therapeutic support. Many medications prescribed to foster children are not approved for use in minors, yet they are often given at a young age and high doses. Additionally, many foster caregivers lack the training to understand or properly manage these medications, leading to further risks. This form of behavioral control is very dangerous as psychotropic medications act on the brain and central nervous system, which causes changes to mood, behavior, or perception. They can be effective treatments for mental health conditions and work when prescribed carefully, but in situations with behavior control, these medications are not necessary. For example, the findings show high rates of children in group homes receiving an ADHD diagnosis following high rates of psychotropic medication prescriptions, also found by Boyd, which has led to concerns about the inappropriate use of ADHD medication. Considering the serious side effects of psychiatric medications, such as nightmares, hallucinations, suicidal thoughts, and even death, medications must be prescribed delicately with utmost care. Prescribing medication in adults requires consistent monitoring, which should apply to children too, especially because higher doses can do so much more damage in young children. In this table from Rose, you can see the amount of medications that are given rather than the actual therapy. So much higher rate, you can see psychiatry and non-stimulant ADHD medications outweigh the assessments and the treatment of mental health issues. This leads us to the research question. The central research question of this study is Is trauma-informed care training for foster caregivers an effective intervention in reducing the overprescription of psychotropic medications for foster youth aged 5 to 18 in residential care or foster homes? The study's purpose is to assess trends in psychotropic prescriptions before and after trauma-informed care training, identify caregiver knowledge gaps on trauma-related behaviors, and promoting non-medication-based behavioral interventions for youth in care. In doing the literature review for this study, I found a lot of critical information that could help assess the intervention treatment. A few things I found were high prescription rates, inadequate oversight, and trauma-informed alternatives. Evidently, as you can see from this graph, studies show that foster youth receive psychotropic medications at a disproportionately high rate. Research from Cosme et al. Found that 41% of foster youth in Nevada were prescribed at least one psychotropic medication, with 28% receiving multiple medications simultaneously. These statistics raise concerns about the role of medication as a primary intervention. Additionally, despite high prescription rates, many foster children do not receive adequate psychiatric evaluations or monitoring of side effects. The absence of standardized oversight system means that prescribing practices often go unchecked, increasing the risk of harmful long-term consequences. Also leads us to ask questions about the role of caregivers and clinicians in the prescribing and monitoring of foster youth who are on medications. Many foster caregivers lack adequate knowledge about the medications prescribed to children in their care, leading to inconsistent adherence and uncertainty about potential side effects. Some caregivers report that they are given little information about why a child is on a particular medication or how to manage its effects properly. As you can see by this chart that I've included by Bowden, you can see their research on different caregivers and clinicians who also don't have enough training to oversee medications. So what do we do from here? In the literature, there is a growing need for non-medication-based interventions. Some studies have shown trauma-informed alternatives. Studies on the wraparound model and the Alabama Psychiatric Medication Review Team demonstrate that providing trauma-informed care for caregivers leads to improved emotional well-being and a reduction in psychotropic prescriptions. Thus, this study proposes implementing mandatory trauma-informed care training for foster caregivers. This training will equip them with skills to recognize trauma-related behaviors, provide appropriate supports, and access non-medication-based interventions. The goal is to reduce reliance on medication while promoting holistic well-being for foster youth. A multitude of informed care training sessions. There will be mandatory trauma-informed training workshops led by trauma specialists, trauma-informed care hotline for caregivers, an online research hub on education on behavioral support strategies, and more policy integration, which requires trauma-informed training for foster caregivers as a part of a licensing requirement. Also, the implementation of state-level oversight of psychotropic medication prescriptions. This study will use a quasi-experimental research design. A group of foster caregivers will receive trauma-informed care training, while a control group will not. Data will be collected at 3 intervals: before training, 3 months after training, and 6 months post-training. As you can see in this chart, I've explained the study type, how many foster caregivers will be assessed, which is 150 across multiple agencies. A data collection method would be used for surveys on trauma knowledge and medication use, prescription rate reviews, caregiver interviews, and the analysis will be used quantitatively, which is statistical comparisons on medication rates, and qualitatively with a thematic analysis of caregiver responses. As this works with sensitive populations and vulnerable people, There are multiple ethical considerations which are crucial to this research. This study will ensure informed consent from caregivers, anonymous data collection, and institutional review board approval. Since foster youth are a vulnerable population, trauma-informed training materials will be designed with cultural competency and sensitivity in mind. In conclusion, the overprescription of psychotropic medications in foster care is a pressing issue that requires urgent reform. By implementing trauma-informed care training for caregivers, we can shift the focus from medication-based management to holistic, trauma-responsive support. This study seeks to provide evidence that will inform policy changes and improve foster care practices. There are multiple long-term and short-term effects that would show positivity towards implementing trauma-informed care. Thank you for your time. I welcome any questions. Goodbye.